In this section of notes, we're going to be looking at the vertebral column and thoracic cage, and so this will complete the axial skeleton tour. Before we get into the vertebral column, I do need you to understand a few vocabulary terms, and so these are bone markings. So there's going to be a difference between bones, the actual name of the entire bone, versus a bone marking, which is a very specific part of the bone. So some bone marking names, when you're talking about a very specific part, will have the word process. And so if you're talking about a process, you mean like a projection or pointy part of the bone. So for example, on this bone here, you can see this is going to be the ulna, which you're not going to hear that today, but you can see how this kind of protrudes out, and this protrudes out. I think of it as like a pointy or pokey out part. And so any part that kind of extends out into kind of this like point, that is considered a process. So this would be called the olecranon process. So it's going to have some name in the front and then process, indicating that it sticks out, it projects out of the bone. The term tubercle means a very small bump. So this will be a small bump on this big giant, on this bone here. This is a rib, so this is considered a tubercle. So there's lots of terms that stand for bump, and so we're going to have several. This is going to be a small bump as a tubercle. A facet or a facet, depending on who you're listening to, I'm going to call it a facet. This is going to be a smooth area or a flat spot on a bone. So you can see here, there's this little flat spot here. There'll be something else that joins up with that and sits in that spot, but this flat spot is considered a facet. So let's look at the vertebral column. So the vertebral column, obviously it's connecting to your skull and going all the way down your back. And its job is to protect the spinal cord on the inside. So you're going to have lots of individual vertebra bones. So a vertebra is one bone, vertebrae, lots of vertebra. So the E makes it plural. And in between each of these bones is an intervertebral disc. So using your roots, inter means between. So it's a between the vertebra bone disc. So it's a disc between the vertebra. And so the purpose of this intervertebral disc is to absorb shock. So your your vertebral column gets a lot of abuse during the day. You're walking, jogging, jumping up and down. So there's going to be a lot of compressive forces. So that disc is going to help absorb that. And so there's two parts to the disc itself. There's the outside part and the inside part. The outside part is much more, that's where our structure is. And the inside part is where you're getting kind of the squishiness, what's allowing it to be that shock absorber. So I think of the intervertebral disc as a jelly donut. And in the jelly donut, you have the outside donut part and then the inside jelly part. And so the donut part would be the Annulus Fibrosis. Notice it's made of fibrocartilage. So this is your structure. So it's cartilage, fibers of cartilage. So that's where all of your integrity or your strength is coming from. So Annulus Fibrosis, fibrous cartilage. The inside, the jelly part, is going to be the nucleus pulpus. So pulpus as in, like you think like pulp. If you have like pulp in your juice or whatnot, it's kind of squishy. Nucleus, like in a cell, it's in the middle. So this pulpy stuff is in the middle of the intervertebral disc. And this is what's going to allow for that shock absorption. So as compressive forces happen, you can see the disc gets a little flatter, kind of bulges out just a smidge, but that's going to allow your this one bone here, this one vertebra, to compress closer to the other vertebra, and that takes that shock. In between the vertebra, when you stack them up, so you can see here's vertebra bone, here's a disc, bone, disc, etc. But because of the shape of a vertebral bone, you can see here, we're going to look at the structure of a vertebra in a second, but notice how it has this curve. It curves up, and then on the top part, it kind of curves down a little bit here, so you have curve up, the curve down. When you stack them on top of each other, that creates this opening. And an opening is called a foramen, so that's the hole. And the hole between the vertebra is called the intervertebral foramen, the hole between the vertebra. And so in between these vertebrae, you have this opening. And since the spinal cord is passing through all of those holes going down as the protection, you have to have ways for information to get into the spinal cord and out of the spinal cord. So if you think of the spinal cord as a freeway of information, so nervous system messages coming from your brain down to the muscles of your body, or information coming from your body, so someone's touching you on the arm, that information has to go up your arm into the spinal cord to go up to your brain so you can process it as like someone's touching me. So you have to have like freeway on-ramps and off-ramps. And so these are going to be those on-ramps and off-ramps, so that nerves can get into the spinal cord to go up to the brain, or nerves can come out of the spinal cord to take information away from the brain. And so you have to have these openings to do that. So there'll be nerves and also blood vessels as well. So let's look at one vertebra. So if you just take generic vertebra, you're going to have these parts to it. You're going to have a body, a vertebral foramen, a spinous process, and a transverse process. So one vertebra, so you're looking, this is a transverse cut, you're looking down. You can see here's this big beefy part. This is the body. On this picture up here, this is the body. That's where the intervertebral disc is sitting on top of. So you can see here's an intervertebral disc right here. So the intervertebral disc sits on top of the body. That's the main structure. There's a vertebral foramen, so in other words, hole in the vertebra. So in this bone itself, you have a hole. That's where your spinal cord is going to go. And you have two parts of the bone that project out. And so that, remember, that's what that process term means. Spinous process, that's this guy back here. So take your hand and put it on your back. And if you run your hand down your back, you feel bump, 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 bump. That's the spinous process. So you're feeling this guy here, lined up one on top of another on top of another. Whereas the transverse processes, so think about transverse. Where's your transverse plane? Right? It goes this way, straight across. So the transverse plane is doing this. Your transverse processes are sticking out along that plane. So here's a transverse process, and here's a transverse process. So in this upright view, you can see the spinal cord's inside the vertebral foramen. You've got your body. This is a transverse process. Here's the other one over here. And then the spinous process is poking out towards the back. What is the purpose of all of these processes? Like, for example, your spinous process in the back, that's going to be an anchor point for muscles. So again, you're looking straight down. You have your body, vertebral foramen, transverse processes coming out the side, spinous process, bump, bump, bump down your back. So here, right here, bump, bump, bump down your back. When you stack one vertebra on top of another vertebra, that's when you get your intervertebral foramen, an opening for nerves and blood vessels. So when you look at these guys here, you can see here's several vertebra, one on top of another. So you can see spinous process, spinous process, spinous process. And you can see there's a transverse process on each side. We're going to be talking shortly about what is attaching to some of those transverse processes. Not all of them, but I do want you to see that not all vertebrae are identical. They all have those parts. There's a body, there's a spinous process. But notice this spinous process here looks different than this spinous process here. This one's much more pointy, but that's because, remember, structure leads to function. So where is this vertebra located versus where's this vertebra located, and what's attached to it? Like how many muscles, what kind of muscles, how big is the muscle, etc. So let's start out. When you look at your whole vertebral column, we're going to break it into 4 sections. And so the first section we're going to look at are your cervical vertebra. Notice there are 7 vertebrae. They're going to number them from 1 to 7. So C for cervical. So your C1 is closest to your skull. Your skull is right up here. Then it goes 2, 3, 4, 5, 6, 7, all the way to the back. Down the back. If you sometimes at the upper part of your back, lower part of your neck, some people may be able to kind of see or feel the C7 poking out a little bit. Everybody's just a little bit different structure. So when you're looking at these 7 vertebrae, we're going to start with what's unique about the top 2 bones, because the very top 2 in the cervical vertebra are allowing your head to move. So their structure is a little bit different. So when you look at these guys, you're like, that doesn't look like my typical vertebra here. No, because these ones have a special job. So your C1 has a very specific name called the atlas bone, and your C2 bone has a very specific name called the axis bone. And you will be held responsible for knowing that the C1 is atlas and the C2 is called the axis. How I remember who does what, like, I don't know if you've ever heard the phrase or saying, like Atlas holds the weight of the world. Actually, I'm going to hit pause and then show you that picture in case you haven't heard that. Okay, so here is Atlas holding the weight of the world. So here's the Greek god Atlas, and he's holding the weight. So let me go back to our notes. Okay, so just so you can that's how I picture it. So since Atlas is holding the weight of the world, in this case, the weight of the world is your head. So he's holding up your head. So on the bottom of your skull, you have those occipital condyles. So those gentle bumps. So definitely a tubercle is going to be smaller. So a condyle is like a gentle hill. They're going to sit in these facets or flat spots. It's not completely flat. There is a slight curve in there of the atlas bone. So it literally sits right on top of it. The axis also has this protrusion called the dens, so he's like a pointy part. The dens sticks up into the atlas, and it kind of like rests right into this spot here. So you can see when the two bones are on top of each other, the dens sticks up, kind of nestled like it's getting a little hug from the atlas bone. Yes, there's this little ligament helping anchor it together. And when muscles pull on your these little processes coming out the side, that's what's causing your head to rotate and say no. So I have this little model here, so of course you can see it in class as well. So I'm looking at the back side. You can see, let me try to get in close here. I'm trying to figure out where the camera is. Oh, it's over here. You can see the dens in the atlas bone, and when I turn, you can see how he rotates around that dens. So if he's like this, let me turn him around this way because this is the way it goes in your head. You're like, no, no. So he goes back and forth that way. If you want a little more in-depth picture, then you can click on this link in the PowerPoint and you can get a better look at that. So let's talk about the thoracic vertebra. So we were talking about cervical up top. Notice he curves in a little bit. Now we're going to talk about these next 12, your thoracic vertebra, part of your thoracic cage. Now, when you look at each of these vertebrae, they're a little beefier than your cervical vertebra. They're going to be kind of taking the weight. They have your rib cage on there. It's going to be responsible for breathing, so that's going to be really important. So on the transverse processes for each of these thoracic vertebra, it's going to articulate, in other words, join up with a bump, a small bump, the tubercle, on a rib to make up your rib cage. So let's look at what that looks like. This is a transverse cut looking down. So you can see here spinous process, transverse processes. Here's the rib coming around the sides here. And so you can see this little bump right here connecting to the transverse process. Here's the little bump, tubercle, joining up or articulating with the transverse process. And so that's going to be what's making up your rib cage. You will need to know this definition that articulate means to form a joint or when two bones join together. Getting into your lumbar vertebra, so your lower back, this is going to be, and people think of like when we talk about back pain and things like that, you're really dealing with your lumbar vertebra. There are 5 of those bones. These are really beefy. Look how big the body is here, because these ones are really taking the brunt of your body weight, the brunt of your support compared to any of the other vertebra itself. So you can see how your vertebral column curves in, curves out, curves in, and then it's going to curve out again. Well, your lumbar vertebra do curve in, but when you look at straight up and down, this is where your center of gravity is. So this is kind of like taking all of this weight up here. If somebody is pregnant or they gain a lot of weight, that's going to throw the center of gravity off. Notice that puts the center of gravity out here. Well, to correct for that, the lumbar vertebra curve more to bring that center of gravity back, and that's why somebody who, if they're pregnant, like very pregnant, or they're really overweight, like they could end up with lower back pain. Looking at the sacrum, the bottom of the vertebral column, you notice he looks a little bit different. We had our atlas and axis, they looked different for vertebra, and then these are all just different size of beefiness, and then you get into the sacrum, so he does look different. He has 5 fused bones. You are going to need to know that they are 5 fused bones. And if you forget, you can look at it and count. Think of them as like cake layers. Here's one layer of the cake, 1, 2, 3, 4, 5. Like use these holes to separate it. So there are 5 fused vertebrae, and his big job is stabilizing the pelvis. So when we talk about walking and all of that, this is going to be the back. Here's your hip bones out here. We'll come up with their fancy names later. But you can see how he's very important in stabilizing this pelvic bowl structure. There is no vertebral foramen in the sacrum because remember, they're fused bones together, but the spinal cord is going to end here. Well, how do you get nerves out to the legs or to your abdominal and pelvic cavity, as well as get nerve information back up into the spinal cord? We have to have these holes here. So these little foramina, like little tiny holes, the little foramina are going to be those openings for blood vessels and nerves. So here you can see here's a good picture. Spinal cord stops, and then now we're just going to have branch, 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 and it'll be coming out these holes. Or information will be coming back up into these holes to head back up to the brain. The coccyx, let's try that again, is at the very bottom of your vertebral column, and it is 4 fused bones. So when you look at it, you can count 1, 2, 3, 4. So these guys here just make up what we think of as our tailbone. Different people, just variation in people. Some people can actually be born with a little longer or like bigger tailbone, and when they're born, you can kind of see a little protrusion like at the base above their buttocks. And so sometimes people will have, if they have that little protrusion, then people will tend to have some kind of plastic surgery to correct for that. But you may have had experience with your tailbone of like you fell on it. If you fall on your coccyx or your tailbone, especially like down the stairs, maybe you catch an edge while snowboarding and you fall back, bam, like you can break your coccyx, and this is really painful. This is just an FYI. Obviously they can't cast that up for you like if it was your arm or your leg, and so you just get to sit on a donut trying to keep your body weight from touching those bones because it would be so painful. When you look at your vertebral column, yes, you have these curves. The cervical curve curves in, thoracic curves out, lumbar curves in, pelvic curves out. So this does have all these fancy like posterior concave. I'm not going to ask that. Curve in. That's perfectly okay. This is the technical term, so it is in your notes. But your cervical vertebra curve in, thoracic out, lumbar in, pelvic out. Moving on to your thoracic cage, which obviously is tied into your vertebral column because of those thoracic vertebra. Their big job when you put it all together, it's not only going to be support for your arms, but it is also going to help you in terms of breathing. So when we get into the respiratory system, we'll circle back and talk about the role that the muscles attached to these bones play in helping you breathe. So when we talk about our thoracic cage, we have 12 pairs of ribs. So that means there's 24 total, but there's 12 pairs, and there are 12 thoracic vertebrae. Weird. So each pair of ribs is attached to the transverse processes of each of those thoracic vertebrae. When we break these up, some of them are going to be called true ribs, some of them are going to be called false ribs. I'm going to show you that on this next slide. And it really just has to do with where the bones are articulating with the sternum here. There's this cartilage. It's like who gets their own cartilage and who doesn't. So let's look at that. So when you're looking at pairs 1 through 7, so here's 1, 2, 3, 4, 5, 6, 7. Notice these bones have their own cartilage. It's like I have a bone, I have cartilage, and I'm attached to the breastbone here. So the first 7 are considered true ribs. Everybody else is technically a false rib. I'm going to differentiate between which ones are considered floating, in other words, have no costal cartilage attachment at all, and the false ribs that do still attach to the sternum with costal cartilage. But the deal is these guys have to share. So you notice I'm a rib, I have cartilage, I'm attached. Rib, cartilage, attached. So these are all, I have my own. Once you get down here, this last true rib, bone, cartilage, attached. But look at these 3, 8, 9, and 10. They share. So all of these have their cartilage, then share and merge into one that then attach to the sternum. So these are considered false ribs. These little guys, you can't barely see them. Oh, but over here you can. There's no cartilage at all. They're not attached to anything. They're literally just floating. So they're back there, but there's nothing in the front. So this might be a little bit easier. So you have 1, 2, 3, 4, 5, 6, 7. This guy has a rib with his own cartilage. These 3, the false ribs, share a costal cartilage, and then your floating guys down here. So when you're talking about forming this rib cage, you have to talk about the rib itself. So when you look at one rib bone, these are the parts of a rib bone. So there's the shaft of the rib, sometimes called the body. You can call it either. You just have to be careful because up to this point, we did talk about in a vertebral bone, there is that big beefy part called the body. And so now we're talking about a rib. And if you call this part also the body, you just have to know I'm using that term twice, but they're talking about 2 different parts of 2 different bones. The head of the rib is the part that's touching the body of the vertebra. There's going to be a neck because it's a little skinnier, so it's kind of like you have bulgy head, skinny little neck, and then you're going to have that bump, the tubercle, the part that's actually going to articulate or join up with, right over here, to the transverse process. So you can see how the head of the rib is touching the body of the vertebra there. So here's a top-down view. So again, looking down, here's the body of the vertebra. Here's your spinous process. So this is the back. This is going deep, like into the middle of your body. Here's a transverse process coming out each side. Now you can have on the rib itself, here's the head of the rib touching the body. And then you have this tubercle, which is going to be this bump right here. So you can see bump to the transverse process. The neck is going to be this skinny part right here. So just different views depending on which one like helps you kind of see the picture. Head of the rib touching the body of the vertebra. Neck, tubercle will be here. You've got the shaft or the body of the rib, costal cartilage, and then your sternum. So talking about that sternum, your sternum is made up of 3 separate bones itself. And so you have the manubrium, the body. You're like, oh my God, that's the 3rd place we've seen the term body. That is the 3rd and final time, but it can get confusing. This bone is called the body, and then this little dangly guy called the xiphoid process. You actually can feel your manubrium. If you very gently touch your neck, you can feel your collarbone, and those are technically the clavicles. And so your collarbone, if you come into the middle, you can kind of feel this like indent. This indent is this part here, how it dents down. So that's this piece here. And then your sternum is going straight down. So manubrium is this part at the top, body is this middle part, and xiphoid process is this little dangly guy here at the end. So the whole thing is called the sternum. Now, if somebody was giving CPR and they were placing their hands on the sternum, so you imagine locking your hands on there, like you're somewhere in this zone, and you start pushing down, is it possible that there have been times that people have broken the xiphoid process while trying to give CPR because maybe they were just a teeny tiny bit low? It can happen, but keep in mind, again, what does it cost you? What does it gain you? You're trying to save someone's life. You may get a broken bone, but if you get to live, it's worth the cost of a broken xiphoid process. All right, if you have any questions, make sure you reach out. Have a good day, guys.